Hello, I'm Ashley Black. I cannot wait to collaborate with you and get to know you, and most importantly, help you baby step into this wonderful world of fascia. I want to start by just giving you some basic tips and understanding of fasciablasting so that you feel empowered to just grab the tools and start regenerating your tissue. So when we start trying to understand which tool to use, I think it's very important to explain that fascia has layers. So we have fascia right here at the skin level, and then in various forms, the fascia literally transcends the entire body down to our skeletal system. And the way that I usually explain it, it's like jello, mold, and fruit, okay? So your fascia is everywhere in your body like a jello mold, and then your cells, your organs, your skeletal system, everything else is like the fruit being pushed in. So as you start to fasciablast, just remember that you can transcend like a little submarine down towards the inside of your body, literally everywhere, all over your body. So when we think about those depths, we have 3 layers of skin, and then we have our lymphatic system just below that, which is encased in fascia. But I think where the understanding of fascia goes a little bit awry is when we start to think about the muscles. So I like to use straws to explain, because muscles have fascia around every single individual muscle fiber. So if we picture this and then we picture more and more layers of this, I think it makes the tools make perfect sense. It is very important that this is done on bare skin with oil. And I've included our Blaster Oil Essentials, which is completely non-chemical, and we have it in a roll-on form. That way it makes it super easy to go on, and then you don't even have to put your hands in it, which is important because you don't want your hands slipping around on the tool. There are some people that have really tight fascia, they bruise easily, they've got a sensitive nervous system. Desensitize it by getting some lymphatic drainage and getting some of that garbage out of there. Most people, if you do this for 5 minutes, they'll be desensitized enough to move on to the small claw fascia blaster. What we want to do is actually remodel that tissue all the way down to the bone. So our next type of tool is a small claw tool. So again, going back, we'll transcend the skin and the lymphatic system, but you can see that as you use these claws, they can actually go down into, depending on how thick the muscle is, all the way down through the muscle and into those fibers. And that is actually the mechanism that makes fasciablasting work, because you can imagine if you were using foam roller or something like that, you're going to be surface to the muscle. It's almost like trying to brush your teeth with the backside of the toothbrush. Here's the skin, here's the muscle, and that fascia is gonna be right in between those two. So for your very first time, I want you to use it at that fascial level, and you'll notice that I'm not pushing hard. I am just doing it very vigorous and light. So what you'll feel is that as you begin to do this, the tissue will actually start to loosen, and so as it melts, just like butter, then you can start to chase it and go a little bit further and a little bit further. Most people, when they pick these things up, they want to go like this and grind it. That is not fasciablasting. Fasciablasting is done light and brisk. You can see it, but you can also feel it. So when we're working at those surface muscles, we're going to want to grab our favorite small claw tool. So now picture deeper layers of muscles, somewhere like our leg. So once we've opened this first layer of fascia with the small claw tool, that is when we want to go back with the large claw tool and the nuggets. So just picture that. These claws can actually transcend through this muscle and come out the bottom there and start working into the deeper muscles. You're actually going to give it some pressure. So it's still light and brisk, but you're going to actually be pushing down into the muscle fiber. These claws feel totally different than the small claws. So just make sure that if you pick this up and this hurts, then you just need to back out to the small claw until that tissue has a chance to regenerate. So you only want to use a large claw tool once the body's had a chance to open, and then you can go super deep. The nugget tip is designed for you to be able to push down as deep as you want to go, like deep needle acupuncture, and actually start addressing micro or macro fascial adhesions deep into the muscles. So if you feel something that feels like chunk or a rock or gravel or something like that, you literally just very slowly and carefully push into wherever that pain or sensation is, and then you just wiggle it. So it's the poke and wiggle technique. So I hope that brings clarity around around how we, little by little, layer by layer, use different tools to go deeper and deeper and deeper as the body restores. You might be curious about, well, like, what about this one? What about that one with the longer lengths? So the length is not what's important. The length is totally your personal preference. Like, how can you better leverage the area? What's important is that we go from the surface to the deep. So the process, if you're sensitive, would be lymphatic, get that flow going, small claw, big claw, and nugget. And some people stay at the lymphatic flushers and the small claw for 2, 3, 4 months. And other people can pick it up right away. They're not sensitive. They do small claw, big claw, and they're doing nugget on the first day. So in terms of that progress, we always have to remember that everybody is starting at a different level with how basically trashy their fascia is. I will tell you, fascia blasting, fascia in general needs regular care. And so you should think of fascia blasting like brush your hair, brush your teeth, brush your fascia. The consistency is way, way, way more important than getting one really epic blast, okay? So just make it a part of your routine. We want to tell you right out of the gate that when we have an area where the fascia has become stagnant, either it's thick or it's stuck, whenever we begin to loosen that with fascia blasting, blood supply will be reestablished, okay? So tiny bruises that look like a cheetah actually are really kind of exciting. They are the genesis for remodeling the tissue, and they can kind of tell the story. You can really see where you had a cellulite dent or a wrinkle or a tight IT band, and the bruising is in that pattern. But what I would say is if you have large bruises or they're really dark, you just went a little bit too hard. It's not dangerous, but we definitely want to keep the bruising to a minimum. So just remember, it's layer by layer by layer, not trying to like go all the way down to the bone on the first day. All right, so just remember that fascia blasting is a little bit of art and a little bit of science, and I can't just teach you everything you need to know up front. You will learn this as you go. Just know that at any point you can reach out, DM any of my social media, and we have somebody that full-time is looking out for questions. I'm very, very excited for you to start trying fascia blasting. It is the biggest aspect of our health and beauty, and now you are aware of it and you have the tools that you need to do something about it. So welcome to fascia blasting.